1 second.
Okay.
And we are live now. Hello, everyone. Thank you so much for joining us for another session with WebCeph. Today, we are joined by Dr. Arnelle Wright, a general dentist practicing in Orlando, Florida. So thank you so much for joining us, Dr. Wright. And whenever you're ready, the floor is yours.
No problem. Thank you guys so much for having me. First and foremost, I want to say I'm super honored to be here. I really do not take any speaking opportunity lightly. I'm so thankful for Dr. Park reaching out to me and for you students for just following up with me and being so patient with all of the things that I have going on. And once again, I'm really, really glad to be here. And I hope that everybody who is seeing this broadcast, that you all enjoy my presentation as much as I enjoy giving it. So without further ado, I'll go ahead and get started. Okay, so today I want to tell you guys first and foremost what's going to be discussed. If you've seen me on Smile Shadowers or Fresh Dental Shadowers, you may recognize a little bit of the content. However, there are some twists and turns and some updates since I've given those presentations. So bear with me, it's going to be just as fun, and I'm always growing and evolving. So just stick around until the end. So I'm going to talk a little bit about my background, why I do what I do, my journey into dentistry, my experience while in dental school. I'll give you some pictures that show a typical day in practice with me. And from there, I'm going to talk about some of the CE courses that I'm taking and things that I'm doing to take my approach to clinical dentistry and my leadership ability to the next level. And then I'll talk a little bit about what I'm doing and up to now, if you haven't seen already on social media. Okay. So I am a graduate of the University of Florida College of Dentistry. I am what's called a triple gator. So I received my bachelor's degree from there, my master's degree, and my doctor of dental medicine degree from the University of Florida. I fell in love with Gainesville, and I decided to stick around and just soak up all of the knowledge and education that they were willing to provide me. And some of the deciding factors about me going to dental school was the fact that UF was in the state of Florida. Looking at the cost of attendance, a lot of students tend to look at just the tuition and how much the books and the fees and just certain things are, but looking at the overall cost of tuition, cost of attendance to attend the school, it fared a little bit better for me. And that's actually the school that I wanted to go to. I was adamant about going to the University of Florida because I loved being in Gainesville, and I felt like I knew the faculty and I knew the education, the curriculum a little bit better than any other institution that I had applied to. Additionally, it was close to home, close to my family. I'm a very small girl, like I come from a small town. And so I'm used to being able to zip home, come back to school. So I kind of wanted to keep that closeness to my family. I was familiar with the institution. I loved the academic reputation. For example, the board's passing rate for the national board exam, it's off the charts. It's usually in the 90s, if not 100% year after year. And so I was really, really impressed with that. And I love the mission. Basically, you get a lot of community service. They're really big into giving back into the community, and that is incorporated into the curriculum at the University of Florida. While I was there, I did get some scholarships and some awards, but we're not here to hear all about my accolades, but it was just on the slide, and I kind of wanted to just, put my stamp of approval there. So we'll keep on going. While I was in dental school, I really enjoyed my experience. And this is a question that I get oftentimes on social media. People ask me all the time, what was it like being in dental school? I can only speak about my experience and one institution because that's all I have it to compare to. But what I love to do is talk to other like previous dental students, current dental students, some of my colleagues who went to different institutions, and we always compare, okay, what did you experience? Wow, I didn't go through that. Or wow, I went through this, I had this, and these were the classes that we had to take at this particular point during dental school. But as far as my experience went, for the University of Florida, I tried to learn as much as I could about dentistry, how to be the leader of the practice, because for me, I've always known that I have an entrepreneurial spirit. And one thing that I love about dentistry is that after you finish dental school, you can go right into practice. You don't have to have a residency, although it's very highly recommended for you to get a residency or to do what's called an AEGD or a GPR program, so that you get a little bit more experience before entering into the workplace and taking over a practice. But I actually didn't do that. At the end of my senior year of dental school, I was pregnant with my first child. So I had to take boards while I was pregnant. I had to do all of my licensure exams before giving birth to my first son. And being in dental school, learning everything that I could, I knew that after I finished dental school, although I wanted to specialize, I knew that I was going to need to go directly into practice because I had just had a child. So I wanted to make sure that I learned as much as I could while I was in dental school. I had built very strong relationships with faculty members in different specialties so that I could call upon them, so that I could reach back out to them, and I could use them to help me diagnose if I was in a pinch, which you will be in a pinch at some point throughout your career, and you'll need an extra set of eyes or a more experienced set of eyes. So relationship building is going to be very, very, very important. In addition to learning all that I could, building strong relationships with my peers, my colleagues, and my faculty members, I was very involved in the organized part of dentistry at the student level. So I was involved in the Student National Dental Association at both the local level and the national level. So I was on the national board and the local board. I held positions all throughout dental school. I attended conferences, and I would also attend FDC, which is the Florida Dental Convention. It actually happens every June. And at that convention, I would sit and I would go through the classes that we were allowed to take as students, and of course, visit the vendor fair. So again, I began to do my networking and put my name out there and just build relationships as strongly and as richly as possible. I also attended missions trips, and anytime I was able to perform an exam, as you can see in the picture on the lower, it's on my screen, it's the lower left-hand corner. I think it's the same on yours. But anytime, whether it was domestic or abroad, I would be trying to have my hands in a live patient's mouth so that I could see the structures of the oral cavity, so that I could evaluate the soft tissue, evaluate the hard tissue, so that I had enough exposure to the field while I was in dental school, and as much as I could control. So anytime there was like a sign up for something, to do exams or to do screenings or to place something as simple as sealants, I wanted to be there and square, because I wanted to expose myself to as much clinical dentistry as possible, because I knew once going into practice, I was going to hit the ground running. And so I also, one way that I strategized that as well while in dental school was I held leadership positions to continue to encourage myself, to build myself up as a leader, because I knew running a practice, it involved being the leader and being like the go-to person. And so I didn't want to be afraid of that once I got out into practice, not necessarily so that I knew how to tell people what to do, because I believe that the people that you work with in your team, they're able-bodied, they're mature for the most part, they know what it is that they need to do, but you have to be able to kind of steer the ship and chart the course, if that makes sense. And I also did some tutoring, which I really love. Most of you, if you know me from Instagram, you know that I really, really love to teach. And in fact, before going into dental school, I was a high school science teacher. I spent some time during like the gap while I was waiting to get into dental school, teaching high school science and a little bit of like FCAT math for Florida. It's like a standardized test that students have to take in the state of Florida. And I was the go-to teacher for that as well. So that's kind of where my teaching background comes. I really love doing it. And that's another reason why I still do. Okay, so what is my specialty? So the reason why I changed this slide up is because a lot of people want to know, oh my gosh, do you have to specialize? Or why didn't you specialize? Or should I specialize? So right now, I am a general dentist practicing in Orlando, Florida. I almost did specialize. And as you can see from the pictures on this slide, you would automatically think that I was going to be a pediatric dentist, and that is correct. So leading up to like my 4th year of dental school, I was interested in peds. I loved working with children, and it's because of my background growing up. I didn't have dental care growing up. Our family was not the most wealthy. We were, I guess, okay. I didn't find out that I was poor until I went to college, but we were basically trying to survive. And I know so many families out there, they just don't have the knowledge, or they don't have like the person who's willing to take the time to spend with them. And so for me, as I began to learn more about pediatrics, I started to think, oh man, I would be great as a pediatrics dentist. And so things changed. When I was pregnant, I didn't go into the whole pediatrics route, but that didn't stop me from seeing kids in my practice. So the thing that I love about general dentistry is it allows me to do a little bit of everything. Now that I've been practicing for 4 years, I'm into my 4th year. I'll be 5 years next year. Now that I've been practicing for 4 years and some change, I have decided to kind of fine tune and zero in on total health. And this started, and this is a little bit different from any other presentation that I've given, because I recently experienced an airway workshop at Spear Education in Arizona. You guys, if you follow me on social media, you've probably seen this, but I really, really love the total health perspective of practicing general dentistry. And I'll go into a little bit about that and how I plan to incorporate it in my future practice, and just some amazing parts of just airway and understanding the importance of total health before just drilling and filling. And it's not that it's something that I didn't learn in dental school. You just get introduced to certain topics, and it's bare minimum, but it's going to be really important for you guys as you enter into dental school, and even as you exit, that you know that the 4 years that you're in dental school, it's just the beginning, and it only introduces you to the field. And it's going to be very important that you take those 4 years and you use those 4 years as your starting point to learn more and to fine tune the skills that you've been introduced to. And I'll go into a little bit more of that towards the end, or the latter part of my presentation. Okay. So I mentioned earlier that I went on 2 mission trips while I was in dental school. And I bring this up because I believe this is how I learned to be I was going to say to be a dentist. And that's what I said like months ago, like going on mission trips is how you learn how to be a clinician. But I wanted to actually update it and say it's one of the ways that I learned how to fine tune my clinical skills, because going into the mission trips, I knew how to anesthetize. I was seeing patients just a little bit. You're only seeing like 1 or 2 patients a day. And truthfully, that's not enough for you to get your hands and your mind working in sync to provide like strong clinical care, if that makes sense. And it's not that the institutions do anything wrong. That's just, again, it's the introduction. And then you have to take it and run with it and learn more, and take some CE courses, do workshops, and fine tune your clinical skills. But one way of doing that as a student is by attending mission trips. So one of the mission trips that I attended was in Guatemala. So I went to Guatemala City, Guatemala, and then I also went to St. Elizabeth, Jamaica. And it was phenomenal. It literally opened my eyes to seeing different diseases. So caries, seeing different extents of decay, learning how to be a finer surgeon, how to give profound anesthesia, how to diagnose rather quickly, and how to provide treatment rather quickly, how to sterilize in a developing country, and how to work long hours on your feet, patient after patient, how to get those reps in. Because truthfully, when you're working as a clinician, it's all about reps in order to feel comfortable doing something. So for instance, one thing that some of my colleagues and we talk about is with placing implants. It's all about getting the reps in. So learning how the bone feels, learning about reflecting your flaps. So basically how to be a strong surgeon before you can even begin placing implants confidently. So one way to do that if you can, while you're going into dental school, have your mind set on trying to attend a mission trip as early as possible. Even if you don't have any clinical experience from the beginning, I believe that it's a great introduction so that what you learn on that mission trip abroad, you can bring back and you have it in your arsenal or in your toolkit for once you start seeing patients in the clinical, in the dental clinics, okay? All right, so my practice, where am I? What am I doing? What's a typical day like? That's where we're gonna start with some of these slides. Ooh, a piece of lint was flying around. So, okay, I am located in Central Florida. So in Orlando, Florida, I'm currently practicing at a DSO, which is called, so a dental service organization. It's also known as corporate dentistry. And I've been working, I had worked for one company for the entire time since I've been out of dental school. And now I'm transitioning into a newer practice. I'm opening another practice for another company, which is also considered a DSO. But the primary focus of the patient care that I'll be providing is on surgery. I really, really am strong at surgery. I love providing surgery, extracting teeth, and placing implants, which is why I used that analogy in the previous slide. But I'll be focusing primarily on extracting teeth and doing surgery. Now, where does all this airway stuff come in? The beautiful thing is I'll still be providing general dentistry. So I'm not completely walking away from general dentistry, but I'm taking my skill set to another level. I'm adding a little bit more skills to my arsenal so that I can provide more patient care to more patients. All right. So some of the deciding factors for me landing the jobs that I have, I love, again, being the leader. I believe that I'm strong at it. And I believe that I like to teach people how to be stronger at their jobs, how to do more growth and take a liking to personal growth, because one of my approaches to just my life in general is to always be evolving, always be learning, always growing. And I really love to pour into other people in that same way. And so being at a DSO right now, it allows me to do that. And honestly, it just works for my family and I have 2 young kids. So it works better for our family setup. I love the fact that I am able to provide dental treatment without anyone pushing me to do anything. I have not experienced that. And I know that's one of like a negative stigma about working at a DSO, but that hasn't been my experience. And again, I've been working at a DSO for 4 years. And I've enjoyed having a seasoned dental team at some of the offices that I've been at. I've only been at one company, but I've moved around in a few of the offices, and the dental team really makes the job very easy. So some people have questions about about private dentistry, like working at a private dental office versus a corporate dental office. And again, I only have the corporate dental office to compare it to, but I think that you have to choose whatever path works best for you and your family. For you, if you're solo, if you're single, whether you're married, you have kids, you have to look at all of your options, okay? And so that's one of the things that I really encourage students to do as you're on the job hunt, is to look at all of your options. Now, when you go to dental school, from what I've heard at some recent conversation, is that your faculty members, they may discourage you from going into a DSO. But one of the things that I encourage you guys to do is just look at the options and see if you like it. Take a look, take a tour, see if you can do a working interview, and then you go from there. And that's how you make your decision. But always line your options up and then choose whichever one works best for you. So one other thing that I always do talk about is any important factors to look out for when you're applying to and accepting your jobs. Again, whichever one feels like it's the best fit for you, ask a ton of questions. You never want to go into anything blindly. And I'm just one of those people, like I ask a bunch of questions. I'm sure Dr. Park was like, whoa, like I had a ton of questions for him. I was invited to do this presentation, and I encourage you guys to do the same thing. Again, you want to meet the team, see if you can do a working interview and see if it works out and it just feels right for you. Okay. And then you want to see how you fit into that organization. Okay, so a typical day in practice is we start our day with a morning huddle. Morning huddle is really, really important to I believe just get your day started. It's just like a quick 15-minute meeting, or sometimes it runs over to 20 minutes, but we just review the schedule of the day. We want to know, are the cases here that are supposed to be here? And this is in a general dentistry practice. So whatever I'm supposed to be seating, so if it's a crown that I need to deliver, let's make sure that crown for tooth number 15 is here. It fits on the model and it is for this patient who's coming in today. Is there a partial that we're supposed to be delivering and seating for a patient? Is that here? You know, and you shouldn't only do this for the day before. You should do this like 2 or 3 days in advance, which is what we've gotten in the habit of doing. But I just kind of like to just say, all right, we do like the yesterday, today, tomorrow type of thing. We really want to look and see who's on our schedule. What was their last visit like? Is this their first time here? What is their medical history like, if they were able to provide that for us before coming into the office? And who's on the hygiene side for recall examinations? And so it kind of just gives everybody a play-by-play, so everyone knows, all right, I need to be here at this time before lunch, and then after lunch, this is what we have going on for the afternoon. Okay. And then patient care begins typically at 8:30. So we'll see a slew of patients in the morning. We kind of like to slow down a little bit in the afternoon so that we can also prep for the next day. On some of the pictures that you see on the slide, you see me with a tooth in the forceps because I had just extracted a tooth right there. And I actually think this picture was taken pre-COVID. And I love this picture because I like to show that in dentistry, PPE has been a thing for us for the longest. And I'm glad to know that, the rest of the medical world, they've joined in, that we're protecting ourselves and, just making sure that we're staying healthy. So I love the fact that this picture was pre-COVID right here. So I'm always like gowned up, usually always wearing a surgical cap. That was just how it was for me all the time. Okay, so the next thing is you can see me working on 2 patients, kind of doing some standing. I might have been extracting on that patient in the lower left-hand corner. And then the one of me looking in my book, I actually have certain textbooks, not from dental school. Some of them are from dental school, but some that I've invested in just that I want to keep on my radar and keep at my desk at work, just in case I need to read up on something and I need to refresh my memory. And so I want to encourage you guys to do that. There's always going to be that one textbook that you should have purchased in dental school. And then once you get out, you're like, I should have gotten that textbook. So just find out from upperclassmen and previous, like if there's a new graduate that you're in contact with for your dental school, once you go into dental school, if you can make relationships with upperclassmen to say, hey, should I purchase this book? Or hey, do you think I should just look at a PDF, or do I even need this book? And you should ask certain dentists in your field, if there's anybody that you're very close with, what textbook and what curriculum should you have in your arsenal. So some of the textbooks that I have were from recommendations from faculty members who was like, if I was going into private practice, this is what I would have on my shelf. And if I'm working in the community, I would just have these books. And I have definitely referred to some of those textbooks, and I still do to this day. Okay, so let's talk about some diagnostic information. Now, if you're multitasking, you definitely want to pay attention to this slide because I believe one of your questions is going to come from here. So let's talk about diagnosing. Dentistry is a field where, and medicine is the same way, but we use imaging, we use clinical detection, so looking with your eyes, we use tactile sensation, so the use of our hands with an instrument in our hand to detect what's happening in patients' mouths. All right. And so you see a combination of clinical photos and x-rays. And the tactile sensation is basically taking the dental explorer along the surfaces of the teeth and sometimes beneath the gums to just feel what's underneath there or what's on top of there. Am I getting stuck in one of the pits or the grooves of this person's tooth? That kind of just adds more depth and more information to a clinician's mind already to allow us to easily begin to putting our pieces of the puzzle together. Like I like to look at each patient as a puzzle, and everybody's different. Although there are a standard set of things that we should do for each patient, every case I look at on a case by case basis, so that I don't automatically just jump to conclusions just because all signs lead to one thing, if that makes sense. So the first thing that I do, the way to get the most accurate and the best information in order to develop an accurate treatment plan is really by getting a detailed medical and dental history from the patient. Now, what you're going to be tempted to do once you're in dental school, and especially once you start seeing patients, you're going to be tempted to just say, oh, okay, open up. I just kind of want to look. But the detailed medical history and their dental history is going to serve you so well as you learn more about the oral cavity and the oral systemic connection. So when I say oral systemic connection, I mean the connection between the mouth and the body. And I bring that up in this presentation because, again, now that I've learned more things and I have more information, my mindset is now total health of all of my patients. So not only am I just looking at their teeth, I'm not even looking at that first anymore. I usually always start my examinations with looking at the medical history and their dental history. But as far as evaluating the oral cavity, I'm looking at soft tissues first. So typically, I usually do an oral cancer screening or a cancer exam, right? And that's where we look at the lateral borders of the tongue. We look at the gums. You look underneath the tongue, at the floor of the mouth, the back of the tongue. And then the most important part, in my opinion, because now I love the airway so much, is looking at the back of the throat. Seeing those soft tissues, looking at the tonsils, you can't see the adenoids, but looking at the tonsils, seeing if they are swollen, if they're touching. And I have seen some large tonsils before. Just seeing if the patient has room in their mouth, if their teeth are caving in on their tongue, and that's obstructing their airway. Oops, excuse me, one second. Let's go back. Okay, there we go. So if their tongue is obstructing their airway. And so that's the most important thing that I look for now. Excuse me for that break. I heard my kids just come home, so you guys just got to forgive me. It's like the life of virtual teaching, right? So looking at their airway first and foremost, and then going and looking at the teeth. But once you learn all of these things in dental school, you're going to be tempted to want to do it the other way around. Okay. And so you're going to want to go immediately because they say, oh, I have this cavity. I have this tooth that's hurting me. As you can see you might be able to see my mouse here, but as you can see in the x-rays, like if there's any lesions or if there's any cavities, you're going to want to directly, immediately put your eyes towards the tooth and the teeth. But you don't want to do that. So one of the most important way, the most important information to gather is that detailed medical history, looking at the hard and soft tissues. And then, of course, you want to couple all of that with radiographs. So some of the radiographs that you see here, in the middle, you see a panorex or a panoramic X-ray. Then you see PAs, so periapical x-rays right here and here. So on the lower left-hand side and the lower right-hand side. And then you also see what's called a bite wing x-ray. So that's basically the red one where they just bite down, and you use those to see if there's any decay in between the teeth. You look at the panorex, the periapical x-rays to see if there are any lesions at the roots of the teeth. And then you look at your panorex to look at the jaws and all of the surrounding structures in the head, okay? So you guys may already know that, but I just kind of want to make that plain. And then you also want to make sure that you do a very thorough clinical examination with your eyes. So clinical means just looking with your eyes, and you can see how I'm pulling the patient's tongue or examining the patient's tongue. It looks like it's being pulled, but they just really stuck it out and I just grabbed it with a 2x2. And looking at both sides, front and back of the tongue, and most importantly, the back of the throat, really examining that airway. And as I learn more about airway, I will be posting more about it because it has really transformed the way that I approach clinical dentistry now. It's very interesting to me, especially having young kids, the importance of nasal breathing versus mouth breathing, the importance of evaluating patients who currently snore, and just to kind of take your thoughts and your attention back to the pediatrics side of me wanting to specialize, catching these things early in peds and correcting them before they grow up and adapt to just like malocclusions and to sleep apnea. So that's really, really important to me now. And I'm super excited about being able to incorporate it in my thought process and my approach to patient care. Uh-oh. Okay, so here is right now as a general dentist, this is my thought process, or this was my thought process for making just clinical decisions really quickly. So if I'm looking at the teeth, and if there's a patient who has a cavity, what is it that I'm gonna do? First and foremost, I'm just going to ask one question. Is the tooth restorable or not? And that is going to lead my decision making. So if it's restorable, then I go through a list of options that I have for that particular patient, not based off of any other patients, because it's on a case-by-case basis. And you really want to think about tailoring your treatment to the person who's sitting in your chair. Although, again, there are many factors that, all roads in every patient can lead to one outcome for the most part, but you really want to tailor everything to that patient. And that's kind of where my clinical practice is starting to go now that, again, I'm learning more and I'm just educating myself more and more and more. If the tooth is non-restorable, then I just go to those options. Once it's non-restorable, that means the tooth has to come out. And then from there, I begin to talk to the patient about, these are the decisions that you need to make if you want to replace tooth, or here's the risks or the benefits of replacing versus not replacing. So I'll go through all of that with my patients. And you guys may have seen this on my Instagram. If not, it is still there, but you can kind of take a snapshot of it. And there's some things that I've updated on it since then as well. Okay. So this slide, at first I said, okay, some cases require more attention than others. I believe I said that like maybe last year sometime when I was, or earlier this year. But I have, again, I'm growing always. And so I'm like, hey, I need to teach students to pay attention to all cases, use the same type of care and attention to detail in all cases. So let's talk about the cases that you see here. In one case on the lower right-hand side, I'm treating a patient. I'm basically doing all of my dentistry standing up in a patient who was wheelchair bound. That will come in your office. And one thing I do have to say, I'm going to pub the University of Florida right now. And I'm going to say one thing we did learn was how to take care of patients with special needs. We had an entire like a requirement to see patients that are special needs. And then we had some opportunities to go to a clinic and do more special needs care off campus. So I really, really enjoyed that part of my education because it decreased the fear and the apprehension that I had as a provider to see those patients because they need dental care. And so it was really good to be that doctor and to be the person that patients felt comfortable and they still feel comfortable going to just because I have that training. Now, again, you have to educate yourself and you have to be well-versed in these things, which means you always need to be reading, you always need to be researching, you always need to be collaborating and discussing patient care and caseload with other experienced and seasoned practitioners in your area. And that's something that I do right now in a study club. And I'll talk about that a little bit later. Sorry, I'm getting ahead of myself because I get so excited about this stuff. And then, so the case that you see on the left-hand side is a patient who has braces. Now, from at first glance, if you have no dental knowledge or background, you may be looking at this and you may be like, okay, what's the big deal? It's no big deal. But there is a big deal, which I inherited this case at the practice when I first started. And I didn't know the orthodontist, I didn't know the patient, but the patient came when one of my requirements is, which again, I learned in dental school, was to have wires removed when the patient comes in for their hygiene. So this patient came in for a recall examination. It was my first time seeing him, and I noticed all of the white spots around pretty much every bracket. If you zoom in and look, I think the lighting kind of distorted just a little bit, but you can see white chalky. It's just a white chalky around almost all of the brackets. The thing about ortho is yes, we want patients' teeth to be straight because it's more hygienic. It can be cleaned a lot better. They have room for their tongue. We want to open up the box, all of those things. But what I do not love is seeing demineralization, which is what this is around the brackets. So basically, the patient didn't have good at-home care. So the teeth were being straightened, but they weren't being very well maintained, and the oral hygiene regimen was not very good. So all of those teeth were more than likely going to need to be filled because the enamel underneath those brackets was pretty much soft when I took my Explorer to feel around underneath there. So that's something why I said pay attention to all cases. And you want to train, and I mean, you're going to get this training, this background, and this language once you go to dental school. You're going to learn how to have these conversations with your teammates, but you want your hygienist to take as much care and have and be as concerned about this as you are, because now this is like a case that you're going to have to fill like all of these teeth or do some sort of thing to arrest this decay if it can be arrested. So those are some of the cases that I get to see, and I wanted to show you guys those because it's not like the pretty veneers that everybody gets to see. Because the thing about it, that is, before you can start placing veneers on patients and doing full mouth rehabilitations and doing crowns and placing implants, I really believe that you have to crawl before you walk in your approach to treatment patient care, and you have to be able to identify disease. And in order to identify disease, you have to know what's normal. So I really believe that baseline is so important in our approach to treatment. And I don't think that you should automatically just go and say, I'm going to place all these implants when you haven't been able to identify decay. When should you restore? When should you refer? When should you extract? When should you crown? When should you place an implant, and things like that? So for me, my approach is, and everybody has their own opinion about these things. Now that I've been practicing long enough, I'm just like, oh, okay, I can go and do more complex procedures. But as I first entered into the field, it was really important for me to become a master at identifying normal from abnormal. And I think that the same thing should be true for you guys too. So go into the field trying to learn as much as possible about the norm so that you can easily and accurately identify abnormal, and then you can treat abnormal, and then you can branch out into doing more complex cases because you have a solid foundation beneath your feet. I hope that resonates. That was a long way of saying that. Okay, let's talk about this. So this is a case actually from dental school that I had, and I really enjoyed this case. I didn't get to get follow-up pictures because, as you can see, this is an extensive amount of decay. So this is basically like rampant decay. But there's a lot of things that can be talked about in this case. So the patient came in, they said they wanted to fix their smile. So in dental school, we had to take pictures, we had to do this whole workup of the case. And what I love about this case is that there was basically caries on every single tooth, and there was a different amount of decay per tooth and a different extent of decay per tooth. So that gave me a lot of exposure to how to remove decay, how to restore, whether to do a like a sedative restoration. A sedative restoration is like a temporary filling, and you choose the material that you get to use in those cases so that you can manage the patient and have them come back and then place a final or a definitive restoration. So I got a lot of experience out of this. I did have to pass the case on to the next student who was coming after me because I was graduating. But for starters, the beautiful thing that I got to do with this patient was see what the needs were. I was able to diagnose decay, the extent of decay, restore some decay, extract some teeth, restore some missing or treatment plan the missing teeth to be restored. I think I even did a root canal on this patient, if I'm not mistaken. I got to talk about smoking cessation. So the patient was a smoker. They wanted to stop smoking. So I got to talk about that. I got to talk about oral hygiene and give instructions on how to properly brush your teeth. These are all things that help build your arsenal of your language on how you do patient care, patient education. I was able to even establish a regimen for oral hygiene that I could later on discuss with my hygienist and say, okay, I actually like for the patients to do this, or I've seen good results with this. So I bring this up because I want you guys, I really believe that being a strong communicator and being able to communicate or articulate your thoughts to other people, to your teammates, in a very clear and concise way also gets your point across to your patients, because you won't be able to do all of the patient care, the patient education, the screening. You won't be able to do all of that, and you don't want to do all of that, but you want to educate your staff and teach the people that you're working with your way. And the way to develop your way is to learn it in dental school, practicing it in dental school, and then go out and implementing it in practice 4 years later. So I bring that up for that reason, and to also show you like a really cool case where there was a lot of decay in the mouth. And you don't want to be afraid of these type of patients when they walk into your doors. You just do want to have a very direct conversation to say, all right, we have a lot to work on in this case. It's not going to be an overnight thing. And also, some patients may want to extract all of these teeth, and you may be the person to say, hey, I don't think you should do that. Okay. So this was a really, really fun case that I got to see in dental school. Okay. So what am I up to now? I have a lot of things going on, if you guys did not know, but some of the things that I really, really love is what I'm doing right now, which is teaching and talking and speaking. I really, really enjoy writing. And so I have a few pieces that I've written lately in, right now, I'm the editor of the Dental Society of Greater Orlando. I edit the quarterly journal that comes out every quarter. So I'm heavily involved in organized dentistry at the local, the state, and the national level. So at the local level, I'm the editor of the Journal for the Dental Society of Greater Orlando. At the state level, I am a representative of, I'm on the Council of New Dentists. So because of my position at the national level, excuse me, as the 17th district rep to the ADA for new dentists, that helps me to be on the Council of New Dentists here in the state of Florida. I do teach some online classes. I have a group mentorship program that I just opened enrollment for. And I'm so excited about that because the program is starting to change, where we're going to go into the virtual classroom. And I really, really enjoy helping students begin their dental application well before they're ready to apply. I believe that one of the areas that like freaks students out the most about the admissions and the application cycle is preparing that application in a short amount of time. And so my pre-dental prep courses are really tailored to helping you think about dental school way in advance, at least 1 year in advance. My first cohort of students, I work with them from June of last year to June of this year. And I really believe that they were prepared, even though you're going to have a little bit of jitters before applying. I think they got a lot of knowledge well in advance. And so they didn't really have to scramble. So one of my missions is to really keep students from having to scramble and just feeling overwhelmed when they're doing their application process because they hadn't thought of, or they're being surprised by things as they go along. Whereas if you're in my mentorship program, you're kind of doing this as you go from month to month. There's small assignments that are all tailored to your application that you're working on as you go along. And so once the application cycle opens, you're not going crazy. You're not really in a pinch the way that some students may be because you've been preparing for a really long time. So I really believe that slow growth is still growth. And I really like for students to kind of prepare early so that they can, apply that first time and get in. Excuse me. Okay, so I have let me go back actually. I have some digital resources. If you guys have never researched my Instagram, if you go to instagram.com/the daily dentist, so THEDAILY dentist, DENTIST. I know it's kind of strange, but one thing that I do have are 2 ebooks. One is called The Blueprint, How to Get In and Thrive. And then the other one is the most recent one that I wrote, which is applying to dental school. So just avoiding some mistakes. And again, I really, really love writing, but you can grab those free resources there at the link in my bio on Instagram. I just kind of wanted to plug that because so far I've had some really good feedback from students who've read it. So just go ahead and grab that. And I hope you guys enjoy that. Some new updates, which I am so excited to share about. I already told you guys about my involvement at the national and the state level and the local level. So I've sat on a few panels. I've done some leadership conversations. Most recently, like in the last week and a half, I sat at the New Dentist Council of New Dentists meeting where I shared some updates with the Florida Dental Association about what's happening at the national level and how we can just bridge the gap and make sure that new dentists are getting involved in organized dentistry because it really creates so much access for you. I'm sorry. Oops, excuse me. Oh, let me go back. Ah! Sorry, guys. Okay, there we go. Okay, so I'll take that question in just a moment. And okay, 6:45, we'll wrap up in just a minute. So as I was saying, like I'm able to just help bridge that gap between the local and the national and the state level, which I really, really enjoy doing. And again, this is just a piece that I wrote as the editor of the Dental Society of Greater Orlando. And most recently, I started writing for Spear Education. So I was able to enter a piece in Spear Digest. And so if you've ever interested in continuing education, Spear is definitely something, and I'm not being paid to say this. I just believe in the content so strongly because it has been the organization and the CE that has really changed and transformed my life as a dentist. And I'm glad that I've had that experience so early in my career because now I'm able to sell my patients their health, you know? So that's the thing that I really want them to grasp from coming to see me is that their entire health matters to me, not only their dental health, but by, you know, making sure their airway is managed and they're able to actually breathe very well. You know, I'm going to have better outcomes with their dentistry and they're going to enjoy their lives more. So that's one thing that's really, really important to me. And at this time, I will take some questions and I'll actually just tell you guys where to find me on social media, which is at The Daily Dentist. And you can email me at thedailydentist@gmail.com. And so, yeah, let's go ahead and take some questions. I think I saw something. Maybe I'll stop sharing.
So that was such a cool and informative presentation, Dr.
Was
Wright.
it good?
Yeah, that was thank you. Loved it. So
Thank
we
you.
have a couple of questions, if you don't mind.
Absolutely.
So you mentioned that you were involved with the SNDA in dental school, which was awesome. So do you recommend pre-dental students getting involved with like SNDA and like ASDA or organizations like that?
Absolutely. So ASDA, HSA, SNDA, those are all good organizations for you to become involved in. I know ASDA is basically the parent to ASDA is the ADA, of course. You definitely want to get involved in that. It teaches you so much about just the benefits of being in organized dentistry. SNDA, I loved, and they have a USNDA as well, so an undergraduate Student National Dental Association. So you guys can look those up as well. If you don't have one at your school, research and see where the nearest one is. But even if your school doesn't have a USNDA or a pre-dental ASDA, you can be the one to start one. You can get it started. So you can reach out to whoever the person is for the ASDA organization, and you can begin to just collaborate with them. Now, I know you're like, I didn't go to college to create these organizations, but hey, you will be a forerunner in the field. So it's really, really good to do that, you know? What I really loved about SNDA was just the collaboration and just teaching me how to be like a stronger leader. I really just loved meeting people from different dental schools. And you can also do this through HSA, through USNDA, ASDA, whatever organization it is that you join. If you join it at the national level as well, you begin to make connections. So I have made friends from different institutions that didn't even go to the University of Florida. So that I love that collaborative piece of being in those organizations.
So we have the next question. And the next question is, how has your teaching experience helped practicing dentistry?
Oh, this is a great one. Very simple. It has helped me be a very clear communicator. And it's helped me to not talk over my patient's head. Because think about it, when you become a doctor, you guys are going to be there very soon. You have all of this knowledge and you want to speak science to your patients because you want them to know that, you've earned this. And especially when you're like youthful, you want your patients to respect you and you want them to know that you know what you're talking about. But one thing that being a teacher has helped me do is really help me learn how to kind of come off of my doctor horse or whatever. And not saying that, I don't conduct myself as a doctor and with respect, I do. But the thing is, I'm able to communicate very clearly to them. And so that they can understand and I can meet them at the level of their understanding, if that makes sense.
So this question kind of goes off of the previous one. So you said you were a high school science teacher, which was so cool. Did you have like a moment or like, I guess, an experience that led to the transition from a high school teacher to a dentist?
Okay, so so funny. I didn't even share this, but I didn't get accepted into dental school when I was applying. So I was in between and I needed a job. And I was like, oh, I have all of these science background, all of these, science curriculum. I'm pretty sure I can get a teaching job. And I wasn't afraid to teach at all. The school that I went to, they had the most opportunity for a new graduate. And so that's kind of why I went into high school. Now, there were some students who were like, oh my gosh, I feel like you're like my sister. And I'm like, I'm not, I'm definitely your teacher. But I was doing that in the interim while waiting to get into dental school. And, if I hadn't gotten into dental school, more than likely I probably would have still been teaching. But I knew that being a dentist had been my calling. It's what I wanted to do. And so it was an easy decision for me to transition back into dentistry because that's really what I was doing. I was waiting in the interim before I got accepted anyway.
So regarding your mission trips, so in mission trips, how do you treat patients who need long-term care? Because like I believe that you would only see them for like about a week.
So actually, the two mission trips that we went on, there were clinics that were there that could carry out the remainder of the care. And a lot of the clinics that you do go to, the majority of them are mostly surgery type of clinics for patients who won't ever be able to go to the clinic in their hometown just due to expenses and things like that. So when we come in, we're able to provide that service right then and there. But some of them, they did have some clinics that the patients could continue to go to for a longer term. And I know for the Jamaica one, the following year, I wasn't able to go on that trip, but the following year they had connected with another clinic it was a bigger facility. It had better like chairs, and it was actually it looks very, very like modernized. And so the patients could actually have their treatment there after the mission trip, like the students left, and they could still continue to get treatment there.
So this is probably going to be our last question, and it's my personal question. So what organization did you partner up with for the mission trips?
Okay, so for Guatemala, the mission trip in Guatemala, we went with the Christian Dental Society. I think it was CDS at UF. That was their mission trip. Every year they went in March, if I'm not mistaken. Every year it was with that. And so I was a part of CDS, Christian Dental Society. And so that's why I went. And they picked certain students to go every year. So I was so thankful to get that one when I did. And then the other trip was SNDA for the Jamaica mission trip. And I went like in October on that. So I went to one trip in March and one in October. It was a busy year for missions trips, but I wouldn't change it for the world. I enjoyed it so much. That was probably one of my favorite parts of dental school, is going on those mission trips.
Wow. Anyways, I think that's all the questions we have for today. Once again, thank you so much for joining us, Dr. Wright, and we appreciate you taking the time to speak to us. And also a huge thank you to everyone who joined us today on our live stream. So as always, our post-session quiz will be accessible through our website. And if you're new, just check out the YouTube video we have on like the short tutorial on how to access it. So anyways, thank you everyone, and follow Dr. Wright on Instagram.
Yes, And thank you, Dr. Park, so much. Oh, I couldn't do this without you guys.